Hello, I am Dr. Rupesh Mehta. I was professor and head of the Department of Surgical Gastroenterology at BS Hospital for more than 30 years. What is acidity and what is the medical term for acidity? As you know, stomach produces acid. When the acid escapes into the esophagus or food pipe, then patient has a feeling of burning and which is known as heartburn. This is medically known as gastroesophageal reflux or GERD. What are the common symptoms of GERD? The commonest symptom of GERD is burning sensation in the chest area. This is because the acid which comes from the stomach into the food pipe, creating this problem. Another common symptom is the food comes into the food pipe and right up to the mouth. Sometimes the acid part also comes up and comes up to the throat. This is not vomiting. This is involuntary and it comes up to the mouth. Which are the hidden symptoms or uncommon symptoms of GERD? Sometimes this patient, they come with sore throat, repeated infection into the larynx. Sometimes they have bad teeth. Even the vomiting comes into the throat area, goes into the lungs, producing recurrent chronic cough. The common question is why antacids are not helping this patient for a long period. The role of antacid is neutralization of the acid and it can work for a short period. So if you want to produce long-term result, then there are certain medicines available which will suppress the production of the acid and that can give you long-term result in this acid problem. Does stress and diet increases the problem of GERD? The answer is no. The stress cannot produce GERD. Same way, food cannot produce GERD. But it is observed very clearly that when there is a stress or when the patient has taken excessively fried and spicy food, they tend to have more of GERD symptoms. This can be prevented by reducing your stress and reducing the fried and spicy food. If necessary, the meal should be taken at a frequent interval in smaller quantity. Commonly it is asked that I am fasting. Will it increase my acidity problem? The answer is yes. Because in fasting, the acid production of stomach is continuing and there is no neutralizing factor. So these people will have more problem of acidity if they remain fasting for a long time. How do I know that I have acidity problem? Normal acidity will have some burning sensation. It may not create any major issue to the life of the patient. But in GERD, the frequency of acid coming to the food pipe is more frequent, creating problems during day-to-day life of the patient. This is more common seen at night time, especially after heavy meal. When you lie down, the food has tendency to come up into the food pipe right up to the throat, creating problems. Does acidity have any major problems in the life of patients? Answer is yes. The repeated acid coming to the esophagus or the food pipe in the lower part will produce inflammation, redness, problem in the lower part of esophagus. If this problem remains for a long time, this will produce ulceration, erosion, sometimes even bleeding, and sometimes leading to reduction of intake of food and causing weight loss. Rarely, it can also cause cancer, which is not common, but it is possible if the problem persists for a long time untreated. It is commonly asked, when should I see my doctor? The answer is, if you have repeated problems of regurgitation, that means food coming into your food pipe, coming up to the throat, or if you start having dysphagia. By dysphagia I mean when you take your food, normally it will go down easily, but when you have a problem, you cannot take the food easily, you have to take a glass of water, then you should consult your doctor. If you have persistent severe pain in the chest area, if you start losing weight, if you have anemia, that means loss of blood, due to any reason, such patients should immediately go to their doctors and find out the cause or the problem. Can other digestive problems happen with GERD? The answer is yes. That along with GERD, there are so many other problems that can happen. So it should not be mixed and it should be identified. Can I reduce symptoms of GERD without any medication? The answer is yes. You can have small, frequent meal. After the meal, you should not lie down. You should stand, sit, walk. Especially at night, try to have early dinner, and at least for 3 hours after having dinner, you should not lie down. So if you take this precaution, along with bland diet, less spicy, less fried, you can control your problems without medication. Commonly asked question that can medication help in my problem of GERD? The answer is yes. There are 2 types of medicine. One is antacid, but that will neutralize the acid. It does not have effect for a long period. There is another medicine which will suppress the acid production, what is known as PPI, proton pump inhibitor. The newer drugs can be effective for almost 24 hours. And this drug, when taken, especially in the morning on empty stomach, will have lasting effect for 24 hours. So this medicine, along with your change in lifestyle and food adjustment, you can have absolutely normal life. I would strongly recommend that if the patient has persistent acidity, creating problem in his life, recurrent coughing, recurrent vomiting, dysphagia means inability to take food easily, such patients should always contact proper doctor, take proper advice, and this would definitely help him if the problem is in early stage. Thank you very much.